I want to welcome special guest today, Char Musillo. And, before we get started, just want to talk a little bit about what Char has accomplished in the behavioral health industry. We're talking about a person who turned Treatment Solutions Network into American Addiction Centers. Char was also part of the original management team of American Addiction Centers. Went on to become VP of Sovereign Health Group, and most recently, he was responsible for an implementation and transition that led to an article in the New York Times. But before we get into that, Char, could you please share with our listeners how you got into the behavioral health industry?
Yeah, absolutely. I'll give you the short version.
Right.
I originally I did my bachelor's in psychology and always had an interest in substance abuse. And then I started a master's in clinical social work, and I did an intern for 6 months as a case manager, group facilitator for the state of Florida back in 1999. Right. After doing my 6-month internship, I really kind of felt like, at least where I was working at, they were very good at diagnosing the problem, but not really good at helping with the problem. So because of that and just a few other personal reasons, I decided that I was more interested in the business side of things. So I went on to get my MBA instead. Graduated with my MBA, started working in business, renting call centers, running insurance companies. And then back at the end of 2010, I was contacted by Treatment Solutions Network about stepping in and taking over their call centers, which at the time they didn't even know that I had a background in addiction. So it was just kind of, coincidental when we first got together and talked. But that position sort of took everything full circle. It brought in the original passion I had when I was going for my degree in clinical social work with an emphasis on substance abuse. It brought in, the skills sets I learned from graduating top of my class with my MBA. It brought in all the insurance information that I learned from running insurance companies for several years, as well as all the call center stuff. So I took over running Treatment Solutions Network's call centers, their admissions department, as well as their support departments. And as part of their senior management team, I also was involved in making a lot of the clinical programs and the clinical decisions, for that company. Our success from that company turned into American Addiction Centers. And from there on out, I've had a career, with some other great companies as well. But that would be sort of how I got back involved in the industry. So I've been in and out of the industry since 1999, and have really just been able to, I've explored a few other, businesses or industries. I ran some anti-aging and stem cell companies for a little while, and ran a couple other health and wellness companies. But again, that kind of came back full circle when I stepped back into the addiction industry, because I was able to bring that health and wellness aspect into the addiction industry parts of the behavioral health programs as well.
Wow. Now, when you were in college, was this kind of the end goal? Was this the dream, or did it just kind of come together from just career after career after career and opportunity after opportunity?
It kind of just came together, it sort of all fell together, because originally I wanted to be, originally I was planning on going for my master's in either clinical social work or industrial organizational psychology. So I had an interest in both in, helping individuals one-on-one with behavioral health issues, particularly in substance abuse, as well as the business side of things. So when, I started with Treatment Solutions Network, it really brought all the skills together that I had learned. And even the insurance stuff I had never planned to get into. I just got into that because it was a good opportunity. But knowing that information really helped me to, facilitate a lot of stuff within the addiction industry as well, too. It kind of gave me the aspect of the clinical side of things, helped me, relate to the clinical team. I ran the business aspect of things, but I also understood all the insurance companies in and outs from running insurances for so long. So, all the different skill sets that I had done previously sort of came full circle and brought me back to the passion where I originally had started out. So it was kind of very unique and very exciting way to get back into the field.
So I just want to ask a follow-up about the call centers. So it sounds like, you come into these companies where they're at a certain maturation period. They have had some success, but they're looking to take things to the next level. I mean, for our listeners that might oversee the call center or have ties to the call center, what are the 2 or 3 things that you come in that you commonly see need to be fixed to take things from, where they are today to the next level?
Focusing on just the call center side?
Yeah.
Okay. Well, the call center side, and I've done so for a couple different companies, and then I also did about 3 years of consulting work where I worked with a variety of different companies in the addiction and behavioral health industries for call centers, admissions, clinical sides. So I've done the call center for quite a few companies. I would say some of the most major things that when I first go in there that I look for is, looking to make sure that, first of all, they're doing it from a very ethical manner. That they got the policies and procedures and this, standard operating procedures to make sure they're following up and doing everything correctly. But it also, a lot of it is just getting them to understand the urgency that these people calling in are in life, a lot of times in life-threatening conditions. So we have to help them out. So sometimes you have to have a little bit of tough love and push somebody a little bit towards making a move, because if you hang up and get off the phone with them, a lot of times that was their one time reaching out, and then when you follow up with them a few weeks later, you find out they're dead or in jail or something else very sad. So it's very important to make sure that while you have them on the phone, that you're able to keep them on the phone. The way I would notice some of the biggest mistakes that a lot of companies would make when I first started working with them is they would have a plan of action where the patient would call in and they would get their insurance information and then say, we'll call you back after you run the insurance information. Mm-hmm. And that's probably mistake number 1, because it's a contact ratio and it's very hard to get them back on the phone afterwards. So the way that I set it up, with my teams at the time, was they would call in and we would first get their insurance information, shoot it over to the verification of benefits teams. Then we would go into an assessment that would take about 35, 40 minutes and really get to know the patient, what their needs are, just by asking a lot of very in-depth questions. And that process did accomplish a couple different things. One is when they spend 35, 40 minutes opening up to you on the phone, they're very less likely to hang up and call 3 other companies afterwards because you have that bond with them. You also find out a lot more information on the front call that's going to help you bring them in at a higher level of care, and get more days pre-certed from the insurance companies. But also in a perfect situation, which probably was about 60% of the time, if you do things properly, you'll have that verification of benefits back by the time you finish the call. So when you get off the call with them, you're then able to let them know, well, this is exactly what, your insurance is going to, accept. This is what you're going to need out of pocket. And then you're either able to go ahead and arrange for them to come into treatment at that point, or you're at least getting off the phone with them knowing specifically exactly all the details and everything they need to make a decision moving forward. So just, training the reps, also making sure that you have really good reps that are based on ethics. One of the major things that I would say that I've done with most of the companies that I've worked for is going in and helping them to establish core values right away. And we would make our hiring and firing decisions not only based on performance, but also on the core values. If you have somebody that might be a top level player, but they don't meet the company's core values, they're not a good fit for the company. You've got to make sure that they fit the core values of the company, which is going to be putting the patient first, doing whatever's best for the patient, and and above all, make sure that you're doing it very ethically. I strongly believe that good business is doing things the right way. When you do things the right way, you're successful. When you cut corners and you focus on the money and those things first, although those things are very important, you usually end up not being as successful. When you put the patients first, not only do you get a great reputation and a lot of referrals, from referral partners and from word of mouth, but you're also, providing a better service clinically, and getting a better patient satisfaction from that patient by putting them first when you're starting off from the very beginning, step 1, all the way to the end, step 2 of bringing them into treatment.
Yeah, that's a great point. I mean, I've worked in behavioral health in past life too, and it's just so game changing. Usually at companies I've worked with, they always talk about revenue, right? But in the good companies, we're talking about how many patients' lives we're saving that day, right? And yes, there's a revenue component and people have eyes on that at certain levels, but the culture is around how many lives are we trying to save today? And that just inspires so much more of a mission connection and helps people, stay connected to what they're trying to do.
And absolutely. And you also find that employees typically work a lot harder when they're working for something bigger than themselves. Right. I found that if you have the right employees, they're more motivated by helping the patient out than they are, their paychecks. Although, obviously their paychecks are important to them. They go above and beyond to make sure that they put the patient first. And doing so, is definitely usually the best way to be successful, within, I believe, any industry, but specifically in the behavioral health and addiction industry.
Yeah, no, absolutely. When we first, Engine first got into behavioral health, we were coming from an education industry background. And in education, it was, kind of popular to say, changing futures, changing lives. And we quickly realized in behavioral health, it was, saving lives, right? And we always used to say, I want to, kind of change the world one life at a time. But it was like what am I looking for? Like the verbiage and everything was so much more. We thought education was serious, but behavioral health was so much more serious, right? And it was like you were saving the world one life at a time. And so I really understand what you mean when you talk about those core values and kind of making sure that you have the right people, on the team as you build the team and as you teach them, how to handle the conversation and things like that. I guess talk to us a little bit about how everything's been going right now with the pandemic. And, a lot of people are saying that, addiction has even been on the rise, more so with the pandemic and the shutdown of the economy. How have you guys been dealing with that?
Great question. I'm currently the director of operations for Rogers Behavioral Health, which is one of the best companies, if not, the best company that I have worked for. They're, over 100 years old behavioral health company. We've got several hospitals and then several regional clinics. When the pandemic came, we, got to a point where it was very hard to try to have all these patients on site and, have the safety and everything and the social distance and everything together. So myself, as well as, the rest of the senior management team and the regional director of operations for their different sites, we all worked together very hard to move everything over to 100% telehealth. So we actually took our PHP and IOP programs and made them completely by telehealth. So we were doing, or still are doing, 6 hours of PHP services per day, completely by telehealth, which, as far as I know, we were the first and the only company that I know of that's completely offering services completely for PHP by telehealth. I heard of a few others doing IOP by telehealth, but not necessarily the PHP. But we converted close to 1,000 patients across the country to 100% telehealth, which has been great because we have found that for the majority of the programs, the clinical effectiveness has been just as good. We were able to even get some patients that were, out of locations or in different areas where we may not have locations to, we're able to then participate by telehealth. And Rogers generally as an organization usually has a waiting list for most of their locations. So when we went, and that's based on usually the size or the capacity of how many people can fit in the clinic. So when we switched over to telehealth, we were actually able to provide services to even more people, and the demand for services has definitely been going up. We have had just as many clients, if not more, since we've been doing it by telehealth. And yeah, absolutely, we are seeing as a nation, both in the behavioral health and the addiction industry, throughout the entire country, in both our company and all the other companies that I talk to network, definitely a rise in the need for addiction and behavioral health. And I believe we'll see that continue to rise over the next few months as people, start moving out of the social distancing and, start, looking for more in-person help.
Yeah. So did you guys have a lot of pushback or naysayers, when you went to the telehealth, people thinking, hey, it's not going to work. It's not going to be the same. It's not going to have the same impact.
Yeah, absolutely. Both from, we had some clinical and some technical challenges that we had to overcome. We use Microsoft Teams, which is a great platform. But there is definitely a lot more details than you would, possibly imagine that would go into converting an entire operation, all the employees and all the patients completely over to telehealth. So we did so in several stages, getting all the employees, set up at home with all the, proper equipment, networking, making sure that, we had to change our intake questions for screening to make sure that any of the patients we brought in were able and appropriate to be able to do the telehealth services and also